Can everybody hear me okay? Sorry, I'm actually the courses director for postgraduate nursing. So thank you for joining our presentation for the School of Nursing, Paramedicine, Healthcare Sciences. So what do nurses do? I'm sure most of you that are on this call know a lot about what nurses do, but nursing is a very broad career. It provides autonomous and collaborative care for individuals, families, groups, communities. It's a provision of promoting health, preventing illness, taking care of people when they are ill, people with disabilities, palliative care. And there's a lot of areas where nurses work. So it's not just in the classic clinical setting of a large tertiary hospital. It is in people's homes, in communities, in community care. It is in rural communities. It's in remote communities. So it's a very, very broad role. So if you're looking for something that's got a lot of interest and a lot of opportunity, then nursing's for you. It's diverse, it's rewarding, and it's a degree and a vocation that is in demand locally and around the globe. There's a nursing shortage in pretty much all countries of the world as populations age. So Charles Sturt University has 6 campuses, and they are across a very large area within New South Wales. So as you can see by this map, you can see Port Macquarie. So I'm up in Port Macquarie. I'm in the most northern campus. Port Macquarie campus is located on the beach, so it's an absolutely beautiful part of the world. We also have a campus at Albury-Wodonga, so on very close to the New South Wales Victorian border. We then have a campus in Wagga Wagga, in Bathurst, and in Dubbo. We also have a Charles Sturt University campus at Orange, which doesn't offer the nursing course, but sometimes we have our intensive schools run in the Orange campus. So as you can see, we have a very large footprint within New South Wales. Why study nursing at Charles Sturt University? So I've been working for Charles Sturt for about 13 or 14 years now. I've been a nurse for a very long time, and I joined the tertiary sector as a casual, and now I'm a permanent academic working here. So we have very strong links to the local health districts in New South Wales. We have the opportunity to offer you real-world practical experience in a variety of settings. So it's not just, as I said, in the tertiary hospitals, it's in large and small hospitals and community settings and home-based settings across New South Wales. We also offer some placements for our workplace learning in other states, but primarily our focus is in the New South Wales area. It is a requirement from our accrediting body, ANMAC, that you do 800 hours of workplace learning. Those 800 hours are broken into a variety of subjects and are offered across the academic year. And our course obviously is accredited by ANMAC, which is the Australian Nursing and Midwifery Council, and the Nursing and Midwifery Board of Australia, the NBA. Once you've completed a nursing degree at Charles Sturt, you will be eligible to register as a registered nurse within Australia and look at opportunities for postgraduate work. We've been providing nursing education for over 40 years, so we have a very long-standing reputation in the industry. We tend to have about 3,500 to 4,000 students studying with us across the 3 years, both full-time and part-time. And we have graduated over 10,000 graduates, which is a huge amount of nurses. So we have been running these courses for a long time. Our curriculum is based on person-centered care and safety. We have a variety of learning experiences. So we have face-to-face tutorials, we have online learning opportunities, and we also have simulation laboratories. So our simulation is where you come across mannequins and you learn to do the clinical work that a nurse does. So the hands-on work that you then practice in the workplace learning environment. Assessment tasks are based on real life clinical situations and scenarios. So we bring a lot of work from the clinicians. We bring new case studies all the time from situations that people have found themselves in working as a clinician. And the science content has been redefined to link directly to nursing practice. This is our curriculum. Basically, what it tells you is that the course is a 3-year full-time course. There's a variety of theoretical subjects, simulation subjects where you go into the simulation labs, and also the workplace learning or the work integrated learning subjects. You start the work integrated learning subjects in first year, in session 2 if you're doing full time, and that really gives you an opportunity to understand what nurses do in a clinical environment, but it also gives you the opportunity to have the first year, first session, as getting some understanding of what nursing is and the theory behind the nursing that you're about to practice. We do have some credit packages. If you are you have a diploma of nursing that's been completed in Australia, you do have a credit package available, which basically means that 8 subjects are removed from the course. And if you were studying full time and you have a diploma of nursing in Australia, you would take 2 years to complete the degree full time. And if you have started a Bachelor of Nursing degree in another university within Australia, you may be eligible for some credit of subjects you've already studied. And there is also a credit package for students that have done the proficiency certificate in nursing from Nepal. High school certificates. So for those of you that are coming directly from the high school certificate in Australia or an equivalency, it is an ATAR of about 65. So that does vary depending on the demand, but 65 is an opportunity. If you come in with a Cert 3 or Cert 4, from an Australian institute, there is also opportunity to enter the Bachelor of Nursing. You need to have an English language proficiency, basically equivalent to the MBA requirements for registration. So that's another thing that you can find online. There's also some additional requirements that you will need to fulfill prior to either entering the course or going on your first workplace learning. So you'll need to have a current first aid certificate and a mental health first aid certificate, a national police check, a working with children's check, and there's a variety of immunisations that are required for you to go out on the workplace learning. It's not a requirement for the university sector, but it's a requirement as you are entering aged care facilities or hospital environments. So there is some immunisation requirements for that as well. Simulation. So that's where the fun starts. That's where everybody absolutely loves their nursing course. So it is a simulation of real world opportunities. So we use mannequins, obviously. We use simulated patients where you can question people and take histories. It's done in a simulation area that resembles a hospital or a community setting, and you practice a lot of the skills that you will practice out on your work integrated learning opportunity. And the clinical work that you do in the simulation area is also assessed so that when you go out on your workplace learning, you feel confident to be able to interact with real people, real patients in the clinical environment. 1:16 staff ratio, so it's a really good mix in that area. As I said before, there's 800 hours of workplace learning. It allows you to translate theory into practice. So the theory that you've learned in the theoretical subjects, the practice that you've done in the simulation environment, you are able to then go out and confidently and comfortably achieve those activities in the workplace learning environment. It also gives opportunity for potential employment opportunities postgraduate. And there are many rural, regional and metropolitan placements. So whilst we are a rural university, we do have workplace placements opportunity in large hospitals in the metropolitan area. The Bachelor of Nursing is recognised in many countries. There's lots of job opportunities, both internationally and within Australia. 95% of our nursing grads are employed within 4 months of completing the course. So there's a high demand for Charles Sturt University nursing students, defence health, so defence forces, primary and secondary, justice health, mental health areas, and workplace health and safety. Session 1 begins at the end of February. Session 2 is in July. And as we've spoken before, it's 3 years full-time or 2 years for students with a diploma of nursing. And then there's part-time opportunities. And there's some links. And I think that's probably the end of my presentation.